I'm Colonel Andre Pippen. Thanks for the opportunity to answer your medical questions related to COVID-19. We're excited for the opportunity to tell you all the things we're doing for our service members, civilians, contractors, and their families from the coronavirus. We know there are a lot of concerns and anxiety out there, but we are doing everything in our power to protect the safety of the force. Today, we have assembled a team of experts to answer your questions. And as you can see, we're doing this via VTC to emphasize the importance of social distancing. We need your help to protect the health and safety of the entire military community here in Europe. I want to turn it over to our Command Sergeant Major, but before I do, I want to emphasize that we can and will overcome this challenge if we work together as a team.
Thank you, sir. Good evening, everyone, and thank you for joining us live this evening. I am Command Sergeant Major Matthew Baller, the Interim Command Sergeant Major for Regional Health Command Europe. Before we get to your questions this evening, we realize that there is a ton of information out there and so many different sources that are providing that information, but the one thing that we know is best for all is to continue following the guidance of your chain of command and support your garrison commanders and your leaders in supporting and abiding by the restrictions and things that we have in place to keep our communities healthy and safe. Together, we are going to ensure that we have a united voice supporting one another to keep one another safe throughout our communities. And to do that, we need everyone's help. There's a few admin notes I'd like to cover before we go into your questions this evening. Number one, we're going to make sure that we keep the focus on our COVID-19 response efforts. So please limit your questions to the COVID-19 response, and then we'll make sure that we get back to anyone whose questions that we did not answer this evening. Our PAO team will gather those questions and in the coming days provide a response to your questions on our Facebook page for Regional Health Command Europe. Lastly, we ask that you do not include any personal information or any particular instances that may give reference to an individual or circumstance that may impact and violate HIPAA requirements. We only have 60 minutes for this evening, and so without further delay, we'd like to get to your questions. So we begin our first question, and this comes from Ruth. This question goes out to our subject matter expert, Colonel Cauldron, who is going to introduce himself. Ruth's question reads, could you please explain the steps people, active duty and civilian, should take if they believe they're exhibiting symptoms of COVID-19? Colonel Cauldron?
Good evening. I'm Colonel Rodney Cauldron, the Chief of Preventive Medicine here at Public Health Command Europe. This is a great question, and it's critical. This is one of those areas where individuals can really work to help protect the community, and it is probably the most important step in preventing transmission. As soon as you develop symptoms, you need to isolate yourself away from everybody else. If you're at home, stay at home. If you're in the office, make sure you're not interacting with other people. This is not the time to go out to the commissary or make that last trip to the PX before you know you're going to be isolated for a while. You need to stay away from others. If you need medical care, and you will need to check in to be evaluated for a test, make sure you call first, following whatever local procedures have been established, and go in and get evaluated for this. But please, first thing you need to do is keep yourself away from others and get your family to shelter in place too, at home, while you're being evaluated. Thank you.
Our next question is person didn't leave their name. However, our subject matter expert, Colonel Freeman, can answer this question. The question is, every time I call the lawn stool appointment line, I get a busy signal. How can I call my doctor or find out the status of my appointment?
Good evening. I'm Colonel Randall Freeman. I am the Launch Stool Deputy Commander for Health Readiness and the medical lead for Launch Stool's coronavirus preparedness and response. So our network is very heavily burdened right now with the much higher volume of calls than we usually have. In addition to that, all of our staff that are teleworking also take up part of the bandwidth as well. Our IT team is working with Signal Command, trying to increase the amount of bandwidth. However, that is still a work in progress. Sometimes it may take several tries in order to get through. So I encourage patients to continue calling. Sometimes it may take 3, 4, or 5 tries in order to get through. However, TRICARE Online is another way in order that you can use to connect with your provider. Most of our providers here have decreased their schedules. We're moving mostly to urgent care within the hospital, and a lot of the care we're providing now is through virtual health. So that may be the modality that you would be seen through once you have an appointment with your provider. It may be through virtual health. Thank you.
Thank you, Colonel Freeman. Our next question comes from Ernest. This question is both for Colonel Contino in the medical realm as well as Colonel Pozo Alonso. Ernest's question is there any effort to defer appointments, for example, dental or vision, without hurting unit readiness, so healthy personnel don't take up resources, time, and seats for appointment times, which may be needed?
Good evening. This is Colonel Contino. I am the Chief of Clinical Operations here at Regional Health Command Europe. Very good question. The answer is yes. The call centers and other clinic staff are already moving in the direction of deferring appointments to a later time. This is to make room for the urgent and emergent issues that come up as a result of the COVID-19. All in the effort to maintain the safety of our community. Now, the quickest and safest way to obtain routine care is probably going to be through a virtual health appointment. That's when a face-to-face is not required. Some examples of this may include a periodic health assessment, especially for those of you who are young and very healthy, medication refills in those who have chronic conditions like high blood pressure, asthma, diabetes, to name some. That said, when the clinic personnel and the patient collectively come to a decision that a face-to-face visit is necessary, like for some well baby visits and readiness appointments, they will take all measures to mitigate any potential exposure to the patients. Some of the ways they'll do this is by perhaps using a different location in the clinic, a different time to be seen, and always using personal protective equipment. Thank you.
Colonel Pozo Alonso.
Good evening. Good evening. I am Colonel Manuel Pozo Alonso, and I am the Dental Regional Commander. And I agree, it's a very good question because we have stopped seeing or offering readiness exam appointments due to our COVID-19 posture in order to prevent infection across our population. Yes, there will be a little decrement in our readiness through time, obviously, as we are not keeping up with the dental exams. But we have done a data analysis, and even though we will lower our readiness standards, we will be able to catch up very quickly as soon as we continue to be able to provide exams. We have a great relationship with our units, and our dental readiness has always been very, very high. So at this point in time, we are more concerned with the safety of our population, and we will handle the readiness very, very soon. Thank you.
Hey, this next question is for Colonel Freeman. Matt is asking, for civilians who are no longer seen at Launch Stool Regional Medical Center, but not yet found a German doctor to refill regular prescriptions due to having refills in the system when October came. Is law still going to refill necessary regular prescriptions like asthma medications or insulin since local doctor offices are not seeing people now? That's an excellent question.
So here in Regional Health Command, our pharmacists are able to offer 28-day bridge refills for medications, chronic medications that patients are already established on. And that's for the purpose of bridging that patient until they can establish care with another healthcare provider. That being said, those bridge refills are not for new prescriptions, not for addressing changes in a patient's medical status, but for something that they have been on already, routinely, chronically, and this is just refilling more of the same. I encourage you to call our pharmacy or call our patient administration office, and you can get more details on eligibility for that. But that 28-day bridge refill is not intended to be repetitive, multiple bridge refills over and over again. So there would be a need to try to establish care with another provider. Thank you.
Okay. Our next question is for Colonel Contino. Lynn asks, do you anticipate needing medical volunteers that are in the community? Many of us have signed up with the local Red Cross and the MTF. What training will be provided? I know of one physician and many nurses in our area.
So the American Red Cross does bring on board, provide an orientation for providers, whether they be skill level 1, for example, a physician, skill level 2, like a nurse practitioner or a physician assistant, and really any other healthcare team members for that matter. As far as the training goes, with the American Red Cross, it's the expectation that the providers are not in need of much in the way of training. That said, we do have a plan in place to execute when we do bring on people who perhaps have been out of practice for a while. We want to make sure that any provider we're using, even in emergency capacity, has been evaluated and is prepared to manage patients in the capacity and to the extent of their licensing and their competency. Thanks.
This next question is for Colonel Coldren. Jim wants to know what types of underlying medical conditions makes a person more susceptible to contracting COVID-19.
Sure. As of right now, there's not a lot of data as to what might make a person more susceptible to contracting COVID-19. What we do know is that individuals with some underlying medical conditions are more likely to have a more severe course if they do become infected. Children, for instance, typically have very mild symptoms, but they probably are fairly likely to get infected. Their clinical course, though, is mild, like a cold. Whereas older individuals, people with chronic lung disease, underlying heart disease, even high blood pressure, these individuals tend to have more severe courses and are more likely to have complications.
Thank you, sir. Our next question comes from Valerie and is intended for Colonel Freeman. Valerie wants to know if one of our children have to be hospitalized for COVID-19, what does that look like for parents? Are we allowed to be quarantined as a family in a room at Lawn Stool, or will we be banned from the hospital because of exposure, even if our child is there? We have a newborn and I am very concerned. While we are staying quarantined, my husband is mission essential, so we are concerned about him being exposed and bringing it home.
So our primary recommendation for those that are infected with COVID-19 is to remain at home and remain quarantined or remain isolated in the home. The family should not mingle with that person who's isolated to the maximum extent possible. They should be able to help provide food, help take care of laundry, help with the basic necessities, but being careful to not get in contact with droplets, making sure that there's good hand hygiene, cleaning all surfaces, and the rest. If somebody does become ill enough that they have to get admitted to the hospital, then that'll be somebody who needs additional supportive medical care that cannot be provided on an outpatient basis. That may include supplemental oxygen, having to be on a ventilator, or needing intensive nursing care, something of that nature. Patients that we have, including pediatric patients that may be admitted to the ICU, we don't have, our policy is we don't have visitors in the COVID ICUs. We do have systems set up in which we still allow the family to maintain contact with that patient remotely. However, we don't have visitors inside of the COVID ICU. So it's very important to maintain, as much as possible, maintain hygiene and try and prevent infection. And if someone does become infected, to try and manage as an outpatient. Thank you.
Hey, this next question is for Colonel Coldren. If someone tests positive, how do you know it's okay for them to return to work? Are they tested a second time?
Thank you. The CDC has actually provided us with some excellent guidance on this subject, and by CDC I mean the U.S. Centers for Disease Control. Individuals do not, in fact, have to be tested a second time before they can safely return into the community, return to work, or be taken off of isolation. A certain length of time has to go by from the onset of symptoms, 14 days, and they have to be free of symptoms for 3 days, whichever one of those comes first. But if those two criteria are met, the individual is, in fact, deemed to be safe to return to work, the community, and to come off isolation. Thank you.
This next question is for Colonel Pozo Alonso, coming from Hector. Hector wants to know, he has braces, and his last adjustment was over a month ago. What can he do to continue treatment, or is it recommended to terminate treatment at this point?
That is a very good question, and I happen to be an orthodontist, so I'm happy to answer this question. If the patient that is in braces is going through the regular procedures and is not having any complications, it's perfectly okay to be in those braces without having an adjustment for an extended period of time. The key question is if there is something during the time that you're not seeing the orthodontist, something that could cause a complication, you should call the dental clinic to make sure that we can evaluate it and see how we can mitigate the issue at hand, so you can stay at home and not needing to see the orthodontist. Under regular circumstances, to have an orthodontic appliance without a monthly or 2-month visit to the orthodontist is perfectly fine, as long as you continue to maintain very, very good oral hygiene while you do it.
Next question is for Colonel Baxter, basically virtual health. Jay is asking, I have some basic medical things but don't want to come in and risk exposure. Can I do a virtual appointment?
Hey Jay, this is Colonel Baxter. I'm the Regional Nurse Executive, and the simple answer is yes. Virtual health has been mentioned several times tonight. And so what is virtual health? In this case, in the face of COVID, it can be something as simple as an email, a telephone call, but the fancier technology, things that we're used to, like FaceTime, is a synchronous video visit, right? It's you face-to-face with the provider if that's needed. And there are some medical conditions that do not work with a virtual exam. But for teleconsultation, sometimes it's as simple as a phone call. or it can be a video visit. And the way that you go about scheduling that is just to call your clinic and schedule an appointment. And if it's a specialist, they're going to see if your condition or your complaint is amenable to a synchronous video visit or just a telephone call or just an email to try to address that for you. Thank you.
Thank you, sir. Colonel Freeman, we have another question for you. Grizzly wants to know, when will general surgery be giving appointments again? He was referred to general surgeon, but no appointments are given until further notice. He would like to know when appointments would be available or an approximate time when he could call to make his appointment.
So that is a very good question. Unfortunately, we don't know when appointments will be opened up again for general surgery. Once that occurs, we will make sure to disseminate the information widely through different public affairs channels on our websites. But as of now, we don't know yet when we will be able to move to that posture. Thank you.
Captain Ramsey, this question is for you. Understandably, there's a lot of fear and anxiety surrounding this COVID-19 outbreak. What are some of the things people can do to alleviate stress levels at a time like this? You're on mute. We can't hear you.
We'll come back to you.
So, sir, we can't hear you on this end. We'll come back to you.
Can you hear me now?
Yes.
Go ahead, sir. Thanks.
Okay. Yeah, sorry about the technical difficulties. This is Captain Ramsey from Regional Health Command. That's a great question. I believe with social distancing becoming our new normal, there are a number of things that we can do. The best thing to do, I believe, first and foremost, is to stay informed. Understanding what COVID is and communicating that with your family members. And you can do this by reviewing reliable and credible sources such as the CDC and the Red Cross. Also, the Army Garrison website has some credible information. So being informed is the best thing you can do to mitigate stress levels. And also explaining COVID to your children in a age appropriate manner so that they understand. And just promote the sense of goodness that comes with why we're doing the isolation. Understanding that we're doing it to protect individuals in our community, as well as the overall good as far as the reduction of infection. And then tapping into different activities at home that can just promote family togetherness. Movies, game night, taking walks while maintaining social distances, play. It's important to actually have established a structure in place so that there's a positive, healthy routine, and that everybody kind of knows what to expect every day. So that and checking in with your family, kind of understanding their concerns and addressing them, I think that's the best steps you can take during this time. Thank you.
Thank you, sir. Those are some excellent points, and we appreciate your feedback. Our next question is for Colonel Coldren, and there are many folks who are asking this question. Folks in the community want to know how many positive cases there are in the military community and in the KMC in particular.
Sure. We actually have very few cases, particularly in the KMC area. We have overall in our military community, as of the last time I checked about an hour ago, 78 cases that were diagnosed out of our laboratory at Longeville Regional Medical Center. They are spread out across our footprint, with the majority being in several of our locations. So here in the KMC footprint, we actually have not seen a huge number of cases yet. Thank you.
This next question is for Colonel Freeman. It's about the actual testing process. Someone wants to know why does the test have to go so far up the nose?
So there are areas within the nose, within the mouth, and the pharynx where the virus is more likely to be cultured from. When we swab as part of the test, we have to put it far enough back to increase the chance that we will actually get virus sample in order to be able to get a positive test. If we don't put it far enough back, then there's the chance of getting an increased chance of getting a false negative. So the virus may be there, but we did not pick it up. So that was part of the reason why we put the swab as far back as we did. Thank you.
Colonel Cauldron, another question for you, sir. What can you tell us about the percentage of false positives and false negatives that we're getting from testing?
And that last question was actually a good lead-in to this question. We do not have an exact percentage right now. We're waiting for the CDC to conduct some further studies on exactly that issue. But what we do know is that it has a very low rate of false positives, meaning if it's positive, we are pretty sure that you have COVID, and we will treat you as if you have COVID without a doubt. The false negative rate tends to be higher, so we do not have quite the same level of confidence in a negative result, particularly early in the course of a disease. And for this reason, we may in fact tell somebody that we think they have COVID, even though the test has come back negative. And we may ask them to isolate themselves, stay away from others, and even quarantine their close contacts until we can run to ground whether or not this was in fact a case of COVID or something else. Thank you for that question, though.
This question is for Major Krebs. It's a veterinarian question. Is the vet clinic doing health certificates for soldiers retiring or ETSing? Major Krebs on the net.
Okay, we'll move on to our next question. This one is for Colonel Freeman again. Andrea is asking, if someone in the same household gets quarantined, what does that mean for the rest of the household? Should they still be working if essential personnel with risk of cross-contamination?
If somebody in the home is quarantined, and so that's defined as somebody without symptoms who was a contact of a confirmed case, then that person should remain, as much as possible, remain in their room or remain in a defined area of the house. The other members of the house, they can continue working. They need to make sure that they take precautions when they're interacting with that patient who is, or that person who is quarantined. And precautions including droplet precautions, wiping down surfaces, making sure to use good hand hygiene, and the rest. If the person is instead isolated because they have symptoms, they are infected, infected with coronavirus, then the contacts within that house are then themselves also quarantined, and they should not be out interacting with the general public. Thank you.
Next question is for Colonel Contino. Brandon wants to know, what is the turnaround in COVID-19 lab testing? Are positive cultures taking longer to populate than the ones not detected?
So the answer to that question is it depends. If patients are having symptoms and are tested and the specimen goes to the launch stool lab, from the time that the lab receives it, it's approximately 24 to 48 hours later. That result will be posted in our electronic medical records. So if a patient is tested without symptoms, they may be at a lower priority way that it is structured, and that may take a little bit longer, but there is no one timeline. It depends largely on the number of specimens that they have at any one time and how many, what proportion of those are high priority based on symptoms and other conditions. Thank you.
Okay, our next question is for Colonel Cauldron or Colonel Freeman. Robert wants to know, he's been asked, can COVID-19 be passed through a wound or only eyes or mouth?
So this is Colonel Cauldron. To our knowledge at this time, COVID cannot pass through a wound directly. It does not appear to be a blood-borne pathogen. That said, it's very difficult to have the kind of contact you would have where you could potentially pass COVID to a wound without having close contact with that person. So again, any contact that is close, which is less than 6 feet, 2 meters, any significant period of time spent at that distance with an infected person is a high risk contact. So that we really need to work most strongly. We really need to put our efforts at keeping people at distance. Thank you.
Hey, this is a question that's being asked a lot for Colonel Freeman and Colonel Cauldron. Do you know if people can recontract COVID-19 for a second time if they've recovered?
Colonel Cauldron may have additional information on this. From what I've seen and what I've read, I think the jury is still out to some degree on that. There is likely some degree of immunity that may form after an initial infection, but whether that immunity is long-lasting or to what degree it is, I think we don't fully have the answer yet.
What I will say is, at least in the short term, we are fairly confident that there is no evidence of reinfection occurring shortly after infection. If that were the case, you would see areas such as China, where the rates of infection have gone down. You would not necessarily see such a rapid decrease in the rates. Long term, we will have to see, but this infection hasn't been with us long term enough to make those kind of determinations.
Colonel Contino, Mary wants to know if we plan on testing contacts of COVID positives or suspected COVID positives with mild symptoms similar to what the Germans are doing now.
So this speaks to the latest Center for Disease Control's recommendations on testing, but also has to include what our United States Army Europe leadership is putting out. And now the criteria for testing and in submitting specimens has changed a little bit, but I think for the most part, the main answer is that the United States Army Europe team, in a matter of public safety, has chosen to test those who are, number one, at high risk by virtue of having symptoms. Number two, if they are close contacts, which speaks to the question itself. Now that close contact may be either at home or in a work environment. If it's in a work environment, the close contact, the way the United States defines it, is if there's a prolonged period of time when you're 6 feet or closer to that, or closer than 6 feet to that individual, and it defines prolonged time as 10 minutes or more. Or if you have had exposure to a person's secretions inadvertently through a cough or a sneeze. So those are the number two and number three. And then the fourth priority for testing would fall more into the lines of what the senior responsible officers feel is necessary in the name of public safety. There may be some areas, for example, in Europe, where they've chosen to test people in an area out of concern that there may be more cases that they've already identified. So don't be surprised if there are people that are tested perhaps without symptoms. However, the CDC's recommendation is very clear and does not include testing those who don't have symptoms. It highlights those who are hospitalized, healthcare workers with symptoms. That would be priority 1. Priority 2 for testing by the CDC would be people who are having symptoms that may live in a nursing facility or another long-care facility, that may be over age 65 with symptoms, people with underlying conditions with symptoms, and first responder symptoms. There are lower priorities, but the main talking point here is that symptoms alone do not necessarily guarantee that testing will be done. That's because most people with COVID-19 either do not have symptoms or have mild symptoms and can be safely monitored at home without any testing for that matter. So don't be surprised if you have no symptoms or mild symptoms and you call a hotline, whether that's in Germany or through the nurse advice line or some other means, and you're assessed as having symptoms that can be managed at home. Thank you.
This next question is for Colonel Freeman. Judy wants to know, will well baby visits continue, especially for newborns?
So most of the MTFs in the area have decreased availability of appointments in general, and that is the same for launch stool. However, there are still some routine appointments that can be scheduled. I encourage you to go to the Regional Health Command Europe website, go to the COVID-19 link, and there's a link on there to further information on what services are available by MTFs within Regional Health Command. And that way you can stay up to date on what services are and are not available as we progress. Thank you.
Okay, another question back to Colonel Cauldron. How is it possible that there is only one positive active duty case in Italy, even when the surrounding communities are affected and many families live off post? Is this due to a lack of available tests?
That's a great question. I don't think it's because of a lack of available tests. The testing capabilities are the same in the civilian market as in the military community, because the military community is largely using the civilian hospitals there for testing. So I don't think it's a matter of availability of testing. I think it's a matter of the fact that that community really came together early on and adopted all of the social distancing measures we've been talking about. They closed down their school. They put out information about keeping 6 feet apart. They went to a grab and go at the food court very early on. And they were also very fortunate in that the Italian government took very aggressive steps early on in their outbreak to isolate the communities that had the highest incidence of infections. And this gave the communities in our military communities the chance to prepare and be in an even better position when the COVID came into their immediate surroundings.
This next question is from Colonel Freeman. This person wants to know, who's allowed to know positive results? I have not received my results. However, my husband was informed by his chain of command of my results before I was. Is HIPAA being upheld still?
So, yes, we are still upholding HIPAA principles. However, in a public health emergency, the command has a right to know certain things that affect the ability of the unit to carry out its mission. And part of that is service members who have to be quarantined or have to be placed on isolation because the unit has to be able to account for that service member. If you have not received your notice of your result, please call in to the hospital here at Launchstool, and we will definitely find that result and provide it to you. We are doing our best to keep up with all of the positive and negative results with calling out and notifying patients. So if we missed notifying you, I apologize, and we will definitely reach out and provide that information to you. Thank you.
Thank you, sir. All right, back to Colonel Pozo Alonso. Shelley wants to know, since dental is down to emergency only, are you sharing your employees with the MTFs who need more staff?
Yes, that's a fantastic question too. Yes, absolutely. We are available, and we have been having our soldiers being tasked to augment the MTFs and the health clinics, and we are positioned to continue to do so as much as needed.
Hey, this next question is for Command Sergeant Major Baller and I. Jennifer wants to know, she said she loves to hear from medical more frequently. Will we be doing a medical town halls more often? And we will. A resounding yes.
Yeah, we really appreciate being able to provide feedback to our communities. We want to be transparent and make sure that we're answering all of your concerns and your questions, so you can look forward to more opportunities like this from the Military Health Command here.
So this question right here is for Colonel Freeman. This person wants to know, why are there no other options for expecting mothers in Vincenza? San Bartolo has changed the rules that no fathers can come to appointments, and they are no longer allowed for the birth or visits. Hospital in U.S. is still allowing the father, even if they aren't allowing anyone else. This is a stressful time for everyone, and add to this stress by taking away a mother's support system as well as depriving the father the birth of a child doesn't make sense.
So host nation hospitals across our region are taking measures that they deem necessary to try to help control the spread of the virus within their populations. And we have no choice but to abide by the rules and regulations that they put into place. So I do hear what you're saying. I empathize with the situation. However, if that is the decision a host nation hospital makes in order to assist with their virus control efforts, then that's the condition we have to abide by. Thank you.
Okay, next question is again for Colonel Cauldron. Helen is asking, how does the trace teams determine whom to inform that they were around someone that tested positive? Should it be everyone they were in close contact with in the past 7 to 14 days?
So, no, it's not everybody they were in close contact with. The most critical thing is that we get the people who are most likely to be infectious quarantined first. So when we have a case of COVID, we ask them to provide us with the list of people that they have been in close contact with. And we start with from the time of symptom onset until the time that we are doing the questioning. So that the period during which they were symptomatic, those are the people we want to get into quarantine first, most rapidly. We then go back 48 hours before symptom onset. And right now that is really the recommendation coming from the US CDC, is 48 hours before symptom onset. Any close contact during that period should also be quarantined.
This next question is from Colonel Contino. Alyssa wants to know, why are test kits still in short supply, practically non-existence on post? Yes, our host nation, Germany, is able to maintain a very high level of testing. Why can we not purchase kits from our host nation partners? Will testing be referred off post at any point soon?
So to answer that question, Landstuhl is the testing site in the military in Europe. So Landstuhl has taken measures to get more testing kits. They're also sending off specimens to German labs to answer the question. One of the labs is called Biosenscha, and there's also another possibility in another large town. So it was just yesterday that we sent off at least 40 tests to Biosenscha and around 100 today. So good news there. We have several thousands of kits coming in the near future, so there will be a lot larger testing capability. Another big breakthrough a few days ago was the ability to use saline to transport the swabs and not the tube that has the pink-orange liquid in it only. That's preferred, and certainly when we send it off to the German labs, they like that. But they also can process specimens whether the swab is in a tube with or without the pink-orange liquid. It doesn't matter if it's that or the saline. So we expect more testing capability as we speak. The ability to do several hundred a day is now present at Landstuhl, and they're getting faster every day. Thank you.
Okay, Colonel Contino, don't go anywhere. Got another question for you. Justin wants to know, can you please explain how the tasking of additional service members for medical screening duty at Army-based control points in Germany aligns with social distancing or restrictions of movement based on public health guidance in regards to COVID-19?
There are folks who are tasked to go work, for example, at gates and ask questions. If you notice, they're keeping their distance. So we like the 6 feet. You notice that when you place your CAT card out there, for those of you in the system or your ID, they may be a little bit closer, but it's for a very short period of time. But once your vehicle moves up into the area where they ask the questions, that they're keeping their distance. So they actually are abiding by the social distancing to contain this disease. We ask them, just like ourselves, to engage in this very important measure. If that answers your question, I'm available to go a little deeper. Thank you.
Thank you, sir.
This question is for Colonel Freeman. What kind of circumstances would come up that would force those of us who are pregnant want to deliver at Landstuhl Regional Medical Center to have to deliver at a German hospital?
So we would only send one of our patients to a German hospital to deliver if our own OB services were on divert, if our labor and delivery was on divert, because we had no bed capability. We currently are not in that status. However, if we get filled up, then that would be the case. That being said, we have host nation partners that we have very good relationships with, and they assist us whenever we have those sorts of situations. Thank you.
Okay, we have an interesting question, sir, I think for the two of us. I think Robert is testing to make sure we're doing this live. So Robert wants to know, is there a possible contingency plan in case of a zombie outbreak? Just wanted to stay ahead of the game in that matter. And so I will tell you, I appreciate the lightheartedness, but we're taking all things very, very seriously to protect our communities and the health of our force. When something like this happens, we have a full court press on making sure that we have the systems and processes in place to make sure that we have the facilities, the personnel, and the equipment to isolate, quarantine anyone who may be positive for COVID or any zombies for that matter. So please rest that the garrisons and the community is working very, very hard to continue to control the spread of COVID-19, and we have every effort in place to make sure that zombies aren't encroaching in our military communities. Thanks for that question.
Hey, the next question is for Colonel Coldren from Tyrone. Has Public Health Command Europe begun developing a plan to transition a healthy force back to work?
I actually love that question because it's a great reminder to all of us that there will be life after COVID. And part of that includes returning a healthy workforce back to more routine operations. I don't anticipate that, well, let me say that differently. I do anticipate that life after COVID is going to look different. We are certainly learning a lot about our capabilities as we cope with this disease. But we will work closely with our garrisons and with our other partners to come up with a plan to return the force safely and effectively back to work.
Okay, this question is from Mike and Caddy, and this one is again for Colonel Coldren. Mike and Caddy want to know if grocery shopping for someone positive with COVID-19, are there certain things they should have on hand? Pedialyte, Gatorade, certain fever reducers, etc.
Sure, that's actually an excellent question, and the CDC, the U.S. CDC, has really, really good resources for that. And so I would encourage anybody with that question to go to the CDC website because they have a full list of options. And if I try to replicate that here, I will forget some things. Pedialyte is always great for children with fevers, but any sort of oral rehydration solution also, and that can be diluted juices or importantly just water. Fever reducers will certainly make people feel better. There's a bit of misinformation out there about ibuprofen or Motrin not being a good idea with COVID. That has not actually been demonstrated or documented. That seems to be a perfectly safe alternative to Tylenol for treating fevers. I would also encourage providing plenty of things like Kleenexes, tissues, and if possible, gloves, so that family members can care for somebody safely. And remember those little things that make life worth living, treats and other things that people might actually enjoy eating. Gotta help keep people's spirits up. Thank you.
This next question is for Colonel Freeman. Is there talk of a voluntary early inductions to try to pace the labor and delivery floor?
So right now, the L&D service is not performing voluntary inductions. Inductions may occur after 39 weeks gestation. That's the decision that will be made by the obstetrician, but those will be case by case, so there's not routine voluntary inductions at this time. Thanks.
Okay, we have a question from Tyrone, and this is for Colonel Coldren. Tyrone wants to know, have they begun training teams to clean and disinfect by area to reduce the fear after everyone has been asymptomatic?
Yes, every garrison has reported that they have teams that are trained, and they are training, in fact, more teams to go to common areas that have been visited by COVID patients to ensure adequate cleaning and sanitization of those areas to prevent environmental spread of the disease.
So I think we have a question from Jamie, and Jamie is asking, what is the contingency plan for capacity at the host nation facilities? And I think we'll turn that over to Colonel Contino.
So the contingency plan for host nation facilities, there's a couple different ways to reply to that. I'm going to reply to that with the current capacity as we understand in our managed care division. Our managed care division gets information not only from TRICARE ISOS out of London with offices throughout Germany and field nurses, but also from spot reports of individuals and other resources. So currently across Germany in particular, there is no one place that has closed its doors to Americans to receive COVID-19 care. That said, they may have different criteria for testing. Now, in terms of a contingency, and this is part two, we need to think about what would happen if our host nation facilities no longer had the ability. So, of course, we know there's Landstuhl. Landstuhl has several beds, both on the regular ward and in intensive care to manage COVID-19. Generally, the cases will be mild that are admitted. Very few would require a higher level of care, but that is available. And we're also discussing plans of having the military hospitals that can move, that are mobile, potentially being available in the near future. We don't see that happening in the near future, but that doesn't stop us from planning for that possibility. Thanks.
Okay, the next question is for Colonel Coldren from Melanie. What exactly does prolonged close contact mean? What time frame are we talking about to have an increased risk of getting infected?
The United States Center for Disease Control does not actually define an exact time. So we are actually going with a 10-minute within 6 feet of somebody definition. We arrived at this by looking at the literature and by surveying other health department recommendations. The other thing that would make you a close contact would be if you were to encounter any secretions from a COVID patient. So if you were coughed on or if you were sneezed on, that would, even just that one encounter would make you a close contact. So the rule of thumb is 6 feet for 10 minutes or more.
Thank you, sir. Ladies and gentlemen, that concludes our final question this evening. We realize that many of you have more questions that are out there. Our PAO team is going to go through all of your Facebook posts, collect those questions, and to make sure that we respond back to those questions in the coming days. We want to thank our entire subject matter expert medical panel team. Gentlemen, we appreciate you all being here this evening. We appreciate your time and your feedback as we all continue to work diligently to ensure that we're providing the highest level of care to our communities and to remain transparent in the information that we share to everyone. I just want to provide some closing comments, and I want to begin my comments with a quote from our USER Command Sergeant Major Abernathy, who shared yesterday, and I've heard this same quote on many media outlets, and that is, we have to consider ourselves as COVID carriers, that each of us are positive for COVID, because that enforces the social distancing that we all must continue to enforce. As we go about our day and do our shopping at the commissary, to look around us to make sure that we're not coming in close contact with others. We're doing our part, washing our hands, and making sure that we're not touching our faces throughout the day to unintentionally contract coronavirus through the things that we're touching. Together, without a doubt, if we do our part, both at home, in the workplace, and throughout our communities, we can create a united front to continue the prevention of spreading coronavirus throughout our workplaces and our communities. Thank you again for joining us this evening. I'd like to turn over to Colonel Pippen for some closing comments.
Hey, ladies and gentlemen, thanks again for joining us this evening. The health and welfare of our military family is our number one priority here at Regional Health Command Europe. I want to reassure everyone that our senior leaders and medical professionals are doing everything we can to be sure that we have the medical support within your communities. Either through host nation facilities or augmented medical forces, we will continue to provide the highest level of patient care to our supported communities. Our hearts and prayers go out to everyone who is grieving the loss of a loved one, those currently battling COVID, and to our healthcare professionals throughout the world who are working diligently to treat those affected by COVID-19. We each play a critical role in our prevention efforts. We must continue to maintain our social distancing, wash your hands, and avoid touching our mouths, noses, and eyes. And with a unified front together, we can prevent the spread of COVID-19. Thank you again for joining us this evening. Best wishes to you and your families. Be safe in your endeavors and have a good night. Thanks to all you do to support the mission. Army Medicine, Army Strong.